Hi, and thank you for tuning into Ask a Nurse web series. My name is Claudinita Garcia. I am an ED nurse here at the Brooklyn Hospital Center. And this month we are going to be talking about stroke awareness. So, stroke, what is a stroke? Stroke is essentially an interruption in the blood flow to the brain, either due to a blockage in the blood vessel going to the brain or a ruptured blood vessel that prevents the blood from getting to the brain. Did you know that for every 40 seconds, someone suffers a stroke and that 140,000 people die of stroke, yet 80% of strokes are preventable? Some risk factors for stroke you want to look out for: high blood pressure, which is the number one cause of stroke, cigarette smoking, diabetes, high cholesterol, poor diet, high in saturated fat, trans fat, cholesterol, diet high in calories, which leads to obesity, which we know leads to high blood pressure. Also, diet high in sodium, which also leads to high blood pressure, which we said is the number one cause for stroke. Also, physical activity and inactivity. You want to try to remain active. This will greatly decrease your risk for stroke because physical inactivity, as we know, leads to obesity, which increases your blood pressure. Also, atrial fibrillation or AFib, when the heart upper chambers quiver instead of beating effectively. This leads to blood pooling and forming of blood clots, and AFib will greatly increase your risk for stroke, so you want to look out for that as well. Other diseases that lead to stroke: heart failure, enlarged heart valve disease, congenital heart disease, which is a heart disease that you have from birth, coronary artery disease, which causes plaque buildup in arteries and blocks the flow of oxygen to the brain. Sickle cell disease, which is a genetic disorder affecting African Americans and Hispanic children. Also, if you have a history of stroke or mini stroke, increases the risk of having another stroke. Now, most common symptoms of stroke: confusion, difficulty understanding, dizziness, loss of balance, numbness, severe headache, have trouble speaking, trouble walking, vision changes, and generalized weakness. An acronym that we use here to assess for stroke is BFAST. B for balance, watch for sudden loss of balance. E for eyes, check for vision loss in one or both of the eyes. And F for face, you want to look for an uneven smile or just a facial drooping. A for arm, check if one of the arms are weak. When you have a stroke, it usually affects one side. S for speech, you want to listen to the person speak, maybe ask them questions and just assess to see if their speech is slurred. And T for time, which is the most important one to me. You want to call 911 right away, as stroke is a medical emergency, and stroke treatment and outcome depend on how fast you get to the hospital and the type of stroke the person is having. So when you're transported by ambulance, first responders usually, are able to start your treatment right away and can alert the hospital that a stroke patient is on the way. And this notification just allows the hospital team to time to prepare for your arrival. Prevent, just ways to prevent. Again, you want to just try to manage, like prevent high blood pressure, diagnosing it early, controlling your blood pressure, changing lifestyle, diet, exercise, and medicine are critical to reducing your stroke risk. Smoking cigarette doubles your risk. So if you are a smoker, you want to maybe enroll into a smoking cessation program and avoid secondhand smoke. Lastly, you want to talk to your doctor about risk factors for stroke and talk about ways to reduce your stroke risk. And remember to always take your medicine as prescribed. Other preventative measures for stroke: eat healthy, low sodium diet, plenty of fruits and vegetables. Want to maintain a healthy weight, stay physically active, and limit alcohol use. Just prevent or manage other health conditions such as high blood pressure, high cholesterol, and diabetes, obesity, and such that we mentioned. Here at the Brooklyn Hospital Center, we are a stroke designated hospital, which you'll receive excellent stroke care here. We have a Gold Plus award in treating stroke patients. So some references here are provided. And if you have any questions, you can comment below. And thank you again for tuning into Ask a Nurse web series. Again, I'm Claudinita Gracia, and I thank you for listening.